Hello, my name is Dr. Carlo Oller. I am an emergency physician, and in this patient education video, I'm going to talk to you about just blood pressure. I have videos about high blood pressure and low blood pressure that can be found on PatientEducation.Video and has 100 more videos related specifically to patient care, patient diagnosis, easy to understand videos for your medical care. But I figured I didn't have a video just explaining what blood pressure is. Well, when the blood goes through an artery, it goes under a certain amount of pressure. And blood pressure is measured both in when the heart pumps the blood, it comes out really hard, really fast, and then as the vessels relax, they settle down and the pressure is less. You spend about 1/3 of the time on this high pressure called the systolic blood pressure. That's systole, when your heart contracts and pushes the blood out. And you spend 2/3 of the time on a diastolic pressure, which is basically the baseline pressure where those vessels are relaxing until that next beat and next flow of blood comes through. And so on. So you got systolic and diastolic blood pressure. That's what those two things mean. The acronym is SBP and DBP. It used to be the American Heart Association recommended your blood pressure to be somewhere around 120/80. Now the recommendation is 115/75 because even a 5 millimeters of mercury decrease in blood pressure over time can decrease your risk of cardiovascular risk. That means heart attacks, and that means strokes, and that means peripheral vascular disease and other injuries to your vessels that can lead to other diseases. So the recommendation is to get that pressure down to those numbers. In kids, it's different. They have a whole chart depending on their age and their weight and what their recommended blood pressures are. I'm going to put a chart show the kids normal blood pressures depending on their age range. But for an adult, 115/80. So when blood pressure can be high, and that would be anything above 115/75, most doctors wouldn't even worry until it's like 140/85 or 86, and we'll consider. And one high blood pressure measurement doesn't make you a hypertensive, but the persistent elevation of blood pressure over time. So if we see you and you have no symptoms and your pressure is 140/85, we're just going to say you have high blood pressure reading. Doesn't mean you're a hypertensive patient. But if we check it next week and it's the same, and the next week, and so, then that makes you hypertensive. Now, that same blood pressure with symptoms like headache, lightheadedness, palpitations, kind of achy feeling in your chest, that might deserve the diagnosis of hypertension as is, without it having to have that pattern of tests or time, because it's symptomatic blood pressure. When your blood pressure is high, we call that hypertension. When it's really high, we call that severe hypertension or hypertensive urgency, which urgency means you have chest pain, you have TIAs, you have symptoms of mini stroke, you have other symptoms. And hypertensive emergency is when you have pulmonary edema, a heart attack, a stroke because of the elevated blood pressure. Obviously, depending on the degree of that pressure, how aggressive we're going to treat it. And in the emergency department, we see plenty of people come in with a stubbed toe and the pressure will be 180/90. Now, usually we blame it on the pain. If they have no history, they're asymptomatic, we don't even work it up. We don't even start on treatment. We just tell them to follow up and get that blood pressure check in a week when they're not stressed, when they're not having pain. But I don't ignore a pressure above 180/90 something. It's usually routine for me to at least run some blood work and give them a little something to start bringing the blood pressure down. But we don't want to bring it down to normal. That would be too much of a drop. And actually, there's been evidence that dropping the pressure to normal after it being high for who knows how long can cause heart attacks and strokes. So you don't want to do that. And if you elect to do that, you only decrease the blood pressure by 1/3. Well, which number, the systolic or the diastolic? Well, neither one. You do the mean arterial blood pressure. Well, what is that? I haven't even talked about that. Well, we talk about there being systolic blood pressure, which is that one on the top, the diastolic blood pressure, and the MAP, the mean arterial blood pressure. That's going to be your average over time. Systolic blood pressure only contributes 1/3 of that time you spend at that pressure, and 2/3 by the diastolic. So there's a formula: systolic blood pressure plus 2/3 of the diastolic blood pressure. And that's called the mean arterial blood pressure. So that number you calculate when it's high, you bring it down by 30% and try not to bring it down any further. Again, because of the risk of stroke or a heart attack. Sometimes you give a low dose of medicine, the patient drops all the way to normal. Obviously, that was not the intent, but we should try to avoid it if necessary. Actually, the newer recommendations for treatment of acute stroke, even in the setting of hypertension, is permissive hypertension to allow the pressure to remain high as long as it's not way high, like 180s over 90s. You got to bring it down to that number and leave it there, because decreasing it further decreases blood flow to the area of stroke and can worsen the stroke. So we talk about blood pressure, what it is, how we calculate it, when we worry about it a little bit, when we worry about it a lot, when it needs emergent treatment, and when it does not. So hopefully you learned from this video what blood pressure is and how we measure it. We put a blood pressure cuff. Oh, maybe we should talk about that for a second. And then when we put a blood pressure cuff, the blood pressure inflates until blood flow to your arm stops. There's no blood flow because the pressure is so high. Then the pressure starts releasing until we get a boom, and we hear that systolic boom, because the pressure was high enough to overcome the pressure of the cuff and give you a reading. So that's a loud first sound. Then it goes boom, boom, and then all of a sudden it changes, boom, and becomes really silent. That's what's called the diastolic number, or those are the Korkhoff sounds that you hear when we auscultate. And now the blood pressure machines nowadays, they hear that and that's how they calculate your blood pressure, how you get a number for your blood pressure. When to go to the emergency department. If your blood pressure is a little high, but you have symptoms, chest pain, shortness of breath, headache, dizziness, double vision, go to the emergency department. You need to be evaluated, okay? If you have a high blood pressure, you have no symptoms, just wait a little bit, repeat it again, and see what happens. If it's mildly elevated, there's probably not much you're going to do emergently, other than diet changes, exercise, and things like that that can wait to see your primary care doctor. If your blood pressure is too high, and I would say anything over 170 over 89, that's significantly high. If you've never been evaluated for it, you probably should be checked up. Usually by the time you get to the ER, your pressure will be better anyway, which is, hey, great news, but you probably need an evaluation. So anyway, I hope you learned something with this video. I hope it was useful to you. And if you have comments, suggestions, put the comments below. Ask me questions. I will upload more answers for you. And don't forget to visit www.PatientEducation.Video. That's a website with hundreds of patient education videos just like this one. Hopefully easy to understand for y'all. Bye-bye.